A new study finds that cardiac deaths have risen since COVID-19 with sharper seasonal spikes and more deaths occurring at home. We wanted to learn more about it, so here to help us is our Baptist health expert, cardiologist Dr. Scott Davis. Good morning, Dr. Davis.
Morning, how are you?
Pretty good, especially when you're here.
You're kind.
Dr. Davis, this study which analyzed death certificate data shows a surge in cardiac deaths following the pandemic. Based on this study, what does this tell us?
So what we did was a group out of Massachusetts General in Boston, looked retrospectively at data from 2020 to present and showed that actually deaths in hospital were down. So heart attacks in the hospital, cardiac deaths in the hospital were down, but overall deaths were up, which means that there were more deaths in home. And what that has showed us is that on the heels of COVID, we realized that people were not seeking medical care in general, but specifically cardiac care. Combine that then with just increased sedentary activity, more alcohol use, increased stress, found that there was more in-home deaths, a disproportionate amount of in-home deaths related to COVID. I don't want to get into the impact of the vaccine or the impact of COVID virus as far as, causing myocarditis. But the key thing is on the back end of that, once again, we want to encourage and really emphasize the message of if you are even remotely concerned about your risk for having any heart issues, go seek your healthcare professional. If there's ever any symptoms that you're concerned about, if you've got any kind of risk factors, you're diabetic, mom had a heart attack at 58, then definitely want to encourage you to seek medical attention as far as getting risk stratified. In other words, finding out what your risk is, and let's make sure that we can identify areas that may be of concern from a heart standpoint.
Are lifestyle changes also a part of this?
Big part of it, because we also saw an increase, a 30% increase in the impact of cardiac disease in adults under the age of 45. And so again, a lot of this data is being teased out, but it does speak to certain lifestyle changes that can be beneficial. And so, we always tell people, don't initiate a new aerobic program without talking to your doctor first. But definitely, as we've said many times in this segment, we want you to get off the couch. We want you to, put some miles on your tires on the daily and get out there and do something aerobic, because that's terrifically heart-friendly and also good for your overall health.
Last question, you probably just answered it. What is the takeaway message for people watching?
Well, so the thing is, now that we've moved past the COVID, era, each day and each month and each year, we still want to emphasize the message about, cardiovascular disease claims more lives than diseases 2 through 5 combined. And so we really want to heighten awareness, make sure folks pay attention to their symptoms, their heart health risk, and then to seek out professional care. Come see me, come see your family doc.
All right, Dr. Davis, thank you so much
Good
for
to
your
see you,
time.
man.
As always, if you want to get in touch with Baptist, just head over to their website, baptist-health.com, or give them a call at 1-888-BAPTIST.